Well, good morning, everybody. My name is Dr. Tom Fiala. I'm a plastic surgeon from Orlando, Florida. Today we're going to do some fractional laser resurfacing. I'm going to be demonstrating the use of the Illumine fractional CO2 laser today. Our first patient is Pam, and she's graciously volunteered to help us with this project. Pam is a longtime patient of mine. She's had several cosmetic procedures before. She's also had a fully ablative CO2 resurfacing done in the past. That was done, in the late 90s by another physician. And so she'll be a good one to speak with, comparing the typical recoveries from the ablative full deal traditional CO2 resurfacing compared to what we're going to be doing today. Today, of course, with the fractional approach, we're going to be putting down a little series of polka dot type patterns on the skin with the machine, and it should be much less of a difficult recovery and a much quicker recovery, a lot less downtime for the patient, which is really one of the main advantages of the procedure. Okay, Pam has been having BLT numbing cream on the face, and that gives the face its shiny appearance that you see right now, and it's been on for approximately 45 minutes. Okay, and Pam's reason for being here is basically to improve the skin texture. She, although it's difficult to see now with the ointment on, she's interested in improving particularly the fine wrinkles around the mouth area and in the lower eyelid area as well. So let's talk about this machine. It has an interesting setup in that it has a flexible fiber optic cable which connects the scanner handpiece to the main laser box. And so that makes moving the handpiece around very easy. And the controls are all here on the handpiece, which is quite convenient. Okay? Now, the settings that I'm going to start with are power is 15 watts, as you can see on the main screen here. And this is controlled by this little jog wheel here. Okay, so 15 watts is a good general setting. And we can set the dwell time that for each of the microthermal zones between 2 and 7 milliseconds. Typically for a facial area, depending on their pigmentation and other factors like that, I would use between 4 and 6 milliseconds. So if you multiply your 15 by your 4, you would get 60 millijoule per micro MTZ. And if you had a 6 millisecond dwell time, then you get a 90 millijoule dosing, basically. Okay, for somebody who's got fair skin, you know, like Fitzpatrick 1, 2, and some of the lighter 3s, you know, you can certainly do the 6 millisecond time. So using the handpiece here, I can cycle through the settings with the plus and minus button here, and you can see that the dwell time is changing as I do this. Okay. This machine also has the choice of 3 different density patterns, and those are shown on the upper row of LEDs. There is a 7x7, a 9x9, and an 11x11 density pattern. So essentially, as you go up on this, you're getting more dots in the same size square, so the density of the pattern is tighter, and that's a useful thing here as well. For this treatment, I'm going to start with the medium or the 9x9 pattern. And these settings have just been developed empirically through practice, and I know that they work and that they're safe, and that I can stay out of trouble with a treatment like this. Okay, so that's what we're going to start with. Typically, for the areas around the lower eyelids, or else the neck, if we're going to do the neck, I would reduce the dwell time and power to a lower, more conservative setting. So we're going to put some eye shields on. Again, laser safety is something that's always good to stress in any of these teaching type of things. So I've got a mask on. We've got a smoke evacuator to deal with the laser plume. I'm going to put some little eye shields on you. These metal ones that are non-reflective work well. There's also a small adhesive one that we sometimes use that also works nicely. And of course, we've got the laser signage outside the door of our treatment room, and everybody in the treatment area should be having some laser safety goggles on. Okay, so let's go ahead and pop these on here, Pam. Ready? Mm-hmm. Okay, and these have a little handle. Okay, we have 2 foot switches here. One is for the smoke evacuator, which will be the source of a lot of the noise that you hear during this procedure. The laser machine itself is really quite quiet. You'll hear a little beeping and perhaps a little faint clicking from the handpiece when I fire this, but really most of the noise that you'll hear is from this, the smoke evacuator. Okay? The nice thing about this setup is the smoke evacuator is attached through this little groove, and this tube here allows the laser plume to be whisked away as we go. So it makes it pretty easy to be a one-person treatment procedure. I'm just going to do a little spot up here on your forehead, okay, Pam? And then we'll see how that feels for you. Okay? And you can tell me how it is basically on a 1 to 10 scale, with 1 and 2 and 3 being really pretty mild, 4, 5, 6 being kind of medium, and 7, 8, 9, 10 being pretty tough to take. Okay? So let's just do a little test spot up here. Okay, so if you look at the pattern that's being generated by the scanner, you can see that there's that square pattern, and that's always the way it is with this machine. It's just the one shape, and it's in between these two metal legs, if you will. And this little metal spacer attaches magnetically to the handpiece here, and it gives you the optimal focus depth right away. So you don't have to worry about how far away you should be. You just put these on the skin and you can go. Okay? The foot pedal, if you keep it depressed all the way through, will automatically reset. So once you get handy with adjusting the spacing of this, you can keep the pedal down. If you lift up the pedal halfway through the scan of the square, then you can make a rectangle. Okay? So let's do one here and you can see what I'm talking about. Okay? So you can see the little polka dot pattern that's there. How'd that feel, Pam? Not a big deal?
No.
Okay, good. So let's do more of the same. All right, so we're basically going to line up the next pattern so there's going to be very minimal overlap. Now, it is possible to do more than one pass, which is where we treat everything and clean it up and then retreat the area. That allows a little deeper treatment, but you do lose some of the advantages of the fractional approach because that tends to be more of a fully ablative concept. You can also keep the scanner in the same area and re-depress the pedal and overlap exactly where you went before, and that can sometimes be done for deeper lines. Okay. So along with this one here, I'm setting this up so that we don't zap the eyebrow itself. Pam's had some micropigmentation of that area for basically the eyebrow tattooing, and we don't want to interfere with that. So to get better smoke clearance, we're going to go up to a higher level of suction here. Go ahead. It's going to be a little louder. I'll try to talk more loudly so you can hear me over the machine. And if you see the little skip area, you can go back and fill it in, like there, or like there. Okay, turn your head a little bit to the side. You're going to do this little temple area. It might be a little sensitive because it was on the other side too. So, let's see. And typically, if you're doing a one-pass treatment, there's a fairly predictable post-op pattern that we see. These little white dots, by the time if you were to check the patient at 24 to 48 hours, would be starting to turn a brownish color. There'd be kind of a bronzy, suntan looking background. And the brown dots tend to flake off around day 4 or day 5 after the treatment, revealing the fresher looking skin. Now, even though this laser is set up to be a fairly superficial resurfacing, it's really good for dyschromias and solar changes, and you can certainly get some nice textural improvements with it. In many ways, it's similar more to the active FX type of machine as opposed to a deep FX machine. So what I'm going to do here is we're going to, now having done most of the nose, we're going to sort of do the cheeks and perioral, and I'm going to leave the eyelid area for last. All right, Pam, I'm going to turn your head to the side. Okay, so now we're going to work on the nasolabial creases here, and I'm just going to show an example of a double pulse. So I haven't moved the scanner, and I've gone right back in the same area. Sometimes if people have particularly deep wrinkles, and I'm thinking about doing a double treatment in those areas, I'll outline those deep areas first so that I know that they've been fully treated, and then go back and do the entire face as a unit, double overlapping, I guess, over those heavier wrinkled areas. Okay, so let's go ahead and do the cheeks here. And again, I'm going to stay away on this higher setting from the thinner skin of the lid, and I'm just sort of going to say, okay, from here on down we can do this 15:6 setting. When we do the lips, I usually try to get it right up to the vermilion border. With this machine you can also resurface the neck if one wishes to, but I think it's wise to turn down the power there, since we know there are fewer pilosebaceous units in the neck skin compared to the cheek skin. I tend to treat the neck with a more conservative setting. So I'm getting right up to the mandibular border here. I'm going to go a little bit past that, and then for blending or feathering purposes I'm going to turn down the density. So you'll see I'm switching now to the 7x7, and turn down the power, and I've done it all in the handpiece, so that makes it pretty easy. So let's go along the mandibular border here, and you'll notice that the pattern's a little different, and because there are fewer dots per square centimeter, the scanner can go a little more rapidly. The lighter scan pattern is also less intense, and if you have a patient that is having some soreness with the procedure, that's another option for you to do to get through the treatment. Okay, well that's pretty good. Let's go ahead and work on the other cheek. All right. People have sometimes asked me about combining this with other facial procedures, surgical procedures. I generally am pretty traditional that I don't resurface an area that's been surgically undermined. So I would not be, for example, doing a facelift and a resurfacing on the same area. I think that flap is, that would worry me about a higher risk of wound healing complications. Generally I'll use some BLT type numbing cream. We have that compounded locally for us, and that's the benzocaine, lidocaine, tetracaine traditional recipe. I've tried other ones. Other numbing creams can work. It's just a matter of getting used to one, and we usually have that on for approximately 45 minutes beforehand. Sometimes I'll also pre-medicate people with some oral agent if they are either worried or nervous, and you can use an oral Valium and Percocet for people. Pam, in Pam's case, she was a little worried about this, so she had a 10 milligram Valium pre-med. And I think it's essential that if anybody has a pre-medication, that you've arranged that they have a ride home following the treatment. And that's just a safety item. Okay, so we're at the mandibular border here, and let's see how we're doing compared to the other side. Okay, so now what we have left is the perioral area and of course the eye area, and it's pretty easy at this area at this time to see any skip areas that if I happen to miss one, that you can go back and get it, because you got that little background of erythema that makes it pretty easy. Okay, let's go and work on the perioral. So for this part, Pam, I'll get you to draw your lips together. Another way. Yeah, right. That's good. All right, so let's go ahead and do this. Sometimes this area is a little tender. Good. All right, so I'm just gonna, same thing here. Okay, so you can see I'm doing a second pass on these areas where I've treated those before. She has a little wrinkle there. I'm going to just hit that a second time. In terms of other preoperative things or pre-treatment things that I like to do. You know, people have a history of cold sores or herpetic outbreaks. Of course, we give them an oral antiviral therapy. And usually I like to have the skin prepared with several weeks worth of a topical retinoid, like Retin A. Okay, good. So now we've done all the perioral areas. And I'm going to hit your upper lip in a couple spots one more time, just to really get those stubborn wrinkles that you hate. Mm-hmm. Okay, so bear with me there on that one. Good. Okay. So really now the only remaining area that we're going to treat today would be the eyelid area. So let's go ahead and get set up for that. We're going to lower our settings down and lower our density down. And I'm also going to dial back on the power just a little bit. 12 or 12.5 would be a reasonable thing to do. What I'm going to do now here is I'm going to leave the eye shields in place. I'll just shift them up just a little bit. And then mostly what I'm going to do is by using my fingers and pulling the skin down, we're going to sneak in there and do the lid treatment. So by pulling the skin down, you can see...
Don't be stretching my skin.
Don't worry about it. Alright, and so just by stretching the skin down, I'm going to keep the eye protected, but still be able to sneak in there and get the skin that I want to treat. Yeah, so I'm at 12.5 on the wattage. I'm on the 7x7 pattern and the 4 millisecond dwell time. Okay, so same thing here. I'm just going to, with one hand I'm going to sort of spread, and then the other hand I'm going to position the laser in there. And with my thumb I'm pressing down on the eye shield to make sure that the lid or the eye is nicely covered. A little harder to see this pattern because the settings are less intense. So you just kind of have to remember where you went. Okay, so again I'm just, pulling the skin down, sneaking in here. I mean, I know that I'm not getting completely that last millimeter or two up to the level of the eyelashes, but, safety first. Now, I don't typically resurface the upper lid due to, post-op swelling or edema issues, but you can certainly do a little bit just beneath the brow if you want to. Pam's skin here looks pretty good, so it's kind of an optional thing, but just to show you.
It looks good because of you.
Oh, well, thanks. So let's go ahead and turn off the smoke evacuator. In terms of the post-treatment, typically I've tried a number of different products for various laser balms and so forth, and I keep coming back to good old-fashioned Aquaphor or bacitracin or something like that. They both work. I don't use anything fancy. I don't use any closed occlusive dressings for this. I think it's nice to be able to look at it, and it's very easy for the patient to use Aquaphor or bacitracin, and it works pretty well. Some people scrub off the laser char, and some people don't. I've done it both ways. I think it works quite nicely just to leave the little laser dots on there. You could think of them a bit as a bit of a biologic dressing, I suppose. And it also gives you an idea of the progress when you see those little dots flake off. If I am going to do a full second pass on somebody, then I would usually take a moist 4x4 and scrub off the char that's there. So Pam, how would you describe this whole process?
Easy.
Okay. And how painful was it?
Not at all. I mean, there were certain areas that were sensitive.
Yes.
But other than that, I mean, no.
Okay, good. So on that, 1 to 10 scale, overall, what would you say the soreness rating was like?
3.
3. Okay, so in the mild category, eh? With a couple of hot spots, but overall pretty easy.
Oh, really easy.
Okay, well good. I'm glad you felt that way. That makes me happy.
Oh, yeah.
Okay, so let's go ahead. We're going to take your eye shields off. Okay, yay. Good. And I'm going to goop you up here.
Goop me.
Yeah. Thanks, Lindy. All right, this is very unscientific. We just put on lots of Aquaphor, and really I just keep the patients reapplying this stuff if they feel that things are dry or tight or itchy. That's post-op. Usually step one is to put on more Aquaphor. And then...
and the air doesn't hit it, so it doesn't burn.
Yeah, I think if you keep the Aquaphor on there, and the you've got a semi-occluded wound, it's a lot more comfortable. And most of my patients who've gone through this, you know, they tell me that they're pleasantly surprised that even though they can certainly see some visual changes, that it doesn't feel too bad in terms of the soreness post-op. I would probably say most of my patients who have settings like this, maybe they might take 1 or 2 pain pills at most. And most of them, especially those people who've been through it before and kind of are familiar with the process, may use none at all. And they just say, you know, yeah, it's really pretty straightforward.
Yeah, it's just a sting. That's it.
A lot of people liken it to a sunburn, you know, and but not a particularly bad one.
Right.
Okay, and then especially for people that haven't, patients that haven't been through this before, I think that, you know, seeing the patient fairly frequently post-op, mostly for reassurance and also for your own learning process, and starting to see the typical pattern is a helpful thing. Okay, good. Here, I'll get your arms untucked here. And then you can flash everybody the thumbs up sign.
All right.
Here we go. Yeah, 2 thumbs up.
Ready for the courthouse.
2 thumbs up. I'm ready.
Okay, good.
It is. It is really easy.